isn't it just a Republican versus Democrat thing? Rich versus poor. The poor want free health care, and the rich want to cut taxes.
I don't think so. Well, partly, I guess. But it's not that simple. The real problem, from what I've been learning, is that healthcare costs are starting to gobble up half the economy.
Aha! So we'll have to do rationing, right? Like death panels?
Stop it. Don't use that bullshit word death panels. There's no such thing.
Well, we can't just sit and do nothing. Everyone always wants all of the most expensive tests and procedures. Demand is basically infinite. We can't just spend an infinite amount.
Yeah, geez.
Fine. Forget death panels. But the government shouldn't try to cover everything. Just the basics, like a safety net. If you want more than that, you should have to pay for it.
Oh, and if you can't afford it, you can't have it.
Right.
So that's how you want to ration health care. If you're rich, you get decent health care. If you're poor, you don't get it.
Sorry. I didn't... That's just the way it is. There's no health care in the Constitution.
Well, that's the American way, maybe, but the U.S. is an outlier. Canada doesn't do it that way. They believe that everyone has the right to the same amount of health care.
Right. Single payer. Whatever that is.
I don't see how that can work.
With queues.
Queues?
I mean, people have to get in line and wait. The people who have the most legitimate needs go to the front of the line.
Wow. Who decides that? How do they determine?
The medical experts develop rules. I don't know exactly. It is objective. They know what's a frivolous procedure, and they know when something is truly urgent and life-threatening.
I wouldn't want to be in a system like that, where the government decides when I get health care or not.
Well, it's moot. We're so far off from that here. We don't even have a safety net here. People here can't even get health insurance.
I know, and yet we spend more per capita here on healthcare than any other country in the world. Like, I think 18% of GDP.
Yeah, 18%. I think that's what I read.
And no other developed country spends even, 10%, and yet they have better health outcomes.
We do too have a safety net. Medicare and Medicaid.
Yeah, and if it wasn't for Medicaid, my grandfather would be dead and our family would be bankrupt.
I understand that, but that's why those programs are... The problem with entitlement programs is once you give the people another benefit, it's politically impossible to ever take it away.
No, that's not the issue. The problem in the U.S. is that it's a fee-for-service system. The more procedures a doctor orders, the more money they make. The incentives are all wrong.
That's why it needs to go to HMOs so that I don't know, so that the costs get managed better.
Is that like the opposite of PPOs?
Oh, God, all these acronyms. Does anyone really understand any of this?
I know.
God, it's so mind-numbing.
Well, yeah, it's a serious question. Who's supposed to figure all of this out? Who can solve it?
Not solvable. It's emotional. People can't be rational about it. It's hopeless. And with the baby boomers moving into retirement, hopeless.